What happens when AI can analyze ventilator data faster than a human? When algorithms detect patient deterioration before the bedside clinician? Could artificial intelligence eventually replace respiratory therapists? Or is there one thing AI may never truly understand? Compassion. Welcome to Respiratory Care Made Simple. Today we're talking about a question many healthcare professionals are quietly asking themselves. Will AI outsmart respiratory therapists in the near future? And maybe even more importantly, can empathy, human connection, and clinical intuition ever be programmed into a machine? If you're an RT, nurse, caregiver, or healthcare student, this conversation affects your future directly. So let's break it down honestly, without fear, hype, or science fiction. AI is already entering respiratory care in ways many clinicians don't even realize. Some ICU systems can now detect worsening oxygenation trends, predict patient deterioration, filter false ventilator alarms, analyze waveform patterns, suggest ventilator adjustments, and identify sepsis risk early. In sleep medicine and home care, AI can track CPAP compliance, detect mask leaks, predict exacerbations in COPD patients, and monitor oxygen trends remotely. And honestly, some of these tools are incredibly helpful. AI can process massive amounts of data faster than humans ever could. It doesn't get tired, it doesn't forget trends, and it never looks away from the monitor. Healthcare is not only data. Respiratory care is not just numbers, waveforms, or algorithms. A ventilator alarm might look simple to a machine, but an experienced RT walks into the room and immediately sees something different. Not just the numbers, the patient, their anxiety, subtle facial expressions, fatigue, fear, confusion, family distress, worsening secretions. That quiet sense that something just doesn't look right. AI can recognize patterns. But clinical judgment is more than pattern recognition. Here's the truth most people won't say out loud. AI may replace certain tasks, but replacing true clinical judgment, that's a much harder problem. Because when AI says increase pressure support, an experienced RT is already asking deeper questions. Is the patient tolerating it? Is there auto PEEP? Are they tiring out? Is the cuff leaking? Is this neurologic? Does the family understand what's happening? That deeper layer, the one built from years at the bedside, that's what no algorithm has learned to replicate. Not yet. Now let's talk about the part no algorithm truly understands: compassion. Can AI comfort a frightened trach patient? Can it calm a family during respiratory failure? Can it recognize hopelessness in someone struggling to breathe? Can it hold a patient's hand before extubation? Not really, at least not in the human way. Healthcare is deeply emotional. And respiratory care is one of the most vulnerable specialties in medicine because breathing is personal. When patients cannot breathe, fear takes over. And in those moments, human presence matters. Now here's the good news. AI doesn't have to be the enemy of respiratory therapists. In fact, the RTs who learn to use AI may become more powerful than ever. Imagine having AI tools that help you interpret ABGs faster, identify dangerous trends early, improve documentation, detect ventilator asynchrony, organize patient data, educate families, or reduce burnout. That's not replacement, that's augmentation. The future may belong to RTs who combine human compassion with AI assistance, not one or the other, both. So what should respiratory therapists do right now? 3 things. Number 1, learn AI early. Don't ignore it. Understand how it works in healthcare. Number 2, strengthen your human skills. Communication, bedside assessment, empathy, leadership, teaching. Those are harder to automate. Number 3, become clinically excellent. The stronger your clinical foundation, the more valuable you become, even in an AI-driven future. So, will AI outsmart respiratory therapists someday? Maybe in certain technical tasks. But replacing human compassion, bedside intuition, and clinical wisdom, that's a much bigger challenge. Because patients don't only need information, they need reassurance, they need trust, they need another human being who understands what it feels like to struggle for every breath, and that may always matter. If you enjoyed this discussion, subscribe to Respiratory Care Made Simple for more real-world respiratory education, ventilator insights, trach care strategies, and the future of AI in respiratory care. Comment below, do you think AI will help respiratory therapists or eventually replace them? I'd love to hear your thoughts.